Psychological interventions such as cognitive behavioral therapy, CBT, and emotional processing therapies are emerging as meaningful contributors to cellular longevity, offering benefits that extend well beyond mental health. While these approaches may seem far removed from the molecular mechanics of aging, mounting research reveals a striking link between emotional well-being and the preservation of telomeres, those protective caps on the ends of chromosomes that play a key role in cellular aging and disease resistance. Chronic stress, unresolved emotional trauma, and persistent negative affect have all been shown to accelerate telomere shortening, particularly in high-stress populations such as caregivers, trauma survivors, and individuals with mood disorders. Interventions that reduce psychological distress may, therefore, help preserve telomere length and improve overall physiological resilience. Cognitive behavioral therapy, one of the most widely studied and effective psychological treatments, works by identifying and restructuring negative thought patterns and maladaptive coping behaviors. In doing so, CBT lowers the physiological burden of chronic stress, which is a known accelerator of telomere erosion. Stress triggers the release of cortisol and other glucocorticoids that, when chronically elevated, impair immune function, increase oxidative stress, and promote systemic inflammation, all processes that damage telomeric DNA and inhibit the activity of telomerase, the enzyme that can rebuild telomeres. By helping individuals manage anxiety, reduce rumination, and increase adaptive coping, CBT can lower stress hormone levels and reduce the biological wear and tear that hastens telomere loss. Several clinical studies have demonstrated this relationship. For example, in breast cancer survivors and patients with major depressive disorder, two groups with high psychological and physiological stress, participation in structured CBT programs has been associated with slower telomere shortening over time. One randomized controlled trial found that individuals who completed mindfulness-based cognitive therapy maintained telomere length significantly better than those in control groups, suggesting that mental health care may contribute directly to the slowing of biological aging. While the absolute changes in telomere length were modest, the protective trend was consistent and clinically meaningful, particularly given the chronic inflammation often seen in these populations. Emotional processing therapies, which include trauma-focused approaches, expressive writing, and emotion-focused therapy, EFT, may offer complementary telomere protective effects. These therapies help individuals work through unresolved emotional pain, regulate intense feelings, and access deeper emotional resilience. There is growing evidence that the suppression or avoidance of negative emotions may be just as physiologically damaging as overt stress exposure. Chronic emotional repression has been linked to higher levels of inflammatory markers and more rapid cellular aging. Therapies that encourage open emotional expression, resolve inner conflict, and foster emotional clarity may reduce sympathetic nervous system activation and restore a more balanced hormonal environment, conditions that favor telomere preservation. In addition to their impact on stress and inflammation, psychological interventions may influence telomere length through improvements in sleep quality, behavioral regulation, and health-promoting lifestyle choices. Individuals who experience psychological relief often adopt healthier routines, eating more nutritious foods, engaging in physical activity, and forming supportive social connections, all of which have been independently linked to longer telomeres. CBT for insomnia, for instance, not only improves sleep, but may also indirectly support telomere stability by enhancing nightly DNA repair and reducing oxidative stress during rest. Importantly, these findings highlight the bidirectional nature of mind-body health. Just as poor emotional health can accelerate cellular aging, targeted psychological care can meaningfully impact biological systems. This opens the door to more holistic aging interventions where psychotherapy is not just a treatment for mood disorders, but a proactive strategy for preserving biological youth. The potential scalability and accessibility of these therapies, especially with the rise of digital CBT platforms, make them attractive tools for widespread public health promotion and aging prevention. While more longitudinal and mechanistic research is needed to determine the full extent of psychological intervention on telomere biology, the existing data support a growing consensus. Emotional well-being is not merely a byproduct of healthy aging, it is a driver of it. In a field where many anti-aging therapies remain expensive, speculative, or invasive, psychological care offers a safe, evidence-based, and empowering way to support telomere maintenance and long-term vitality. As we deepen our understanding of how mind and biology intersect, emotional therapies may take their rightful place alongside nutrition, exercise, and pharmacology as foundational tools for longevity and health span extension.